Medical revalidation of Puerto Rico. Meningitis in a newborn. Group B strep. S. agalactiae. Clinical case. Case presentation. A 6-day-old newborn is brought to the emergency department by his mother due to lethargy, poor feeding, fever, 38.5 degrees per 101.3, and irritability. The baby was born full-term via vaginal delivery without complications. On examination, the infant appears jittery with a bulging fontanelle. A lumbar puncture ELP is performed and cerebrospinal fluid CSF analysis shows opening pressure, elevated, WBC count, 2,000 cells of predominantly neutrophils, glucose, 30 milligrams per low, protein, 150 milligrams per low, high, gram stain, gram-positive cocci in chains. Question: what is the most likely causative organism? A. Escherichia coli. B. Listeria monocytogenes. C. Streptococcus agalactiae group B strep. D. Haemophilus influenzae type B. Correct answer C. Streptococcus agalactiae group B strep. Explanation: key characteristics of neonatal bacterial meningitis due to group B strep. Most common cause of meningitis in neonates 1 month old. Gram-positive cocci in chains. Classic risk factor: vaginal delivery from a GBS colonized mother. CSF findings consistent with bacterial meningitis. WBC count, predominantly neutrophils, purulent inflammation. Glucose, bacteria consume glucose in the CSF. Protein, due to blood-brain barrier disruption and inflammation. Transmission, vertical transmission during birth if the mother is GBS colonized. Prevention, intrapartum penicillin prophylaxis in GBS-positive mothers. Treatment, empiric treatment for neonatal meningitis, ampicillin plus cefotaxime. Definitive treatment for GBS meningitis, penicillin G or ampicillin. Why not the other options? A. Escherichia coli, incorrect, gram-negative rod, not cocci in chains. Second most common cause of neonatal meningitis, but often presents with CSF gram-negative bacilli. B. Listeria monocytogenes, incorrect, gram-positive rod, not cocci. Causes neonatal meningitis, but is typically transmitted transplacentally or via contaminated food. D. Haemophilus influenzae type B, incorrect, gram-negative coccobacillus, rare in neonates due to widespread Hib vaccination. Key takeaways for the medical revalidation of Puerto Rico exam. S. agalactiae, GBS, is the most common cause of neonatal meningitis 1 month. CSF findings: high WBC, neutrophils, low glucose, high protein. Maternal GBS screening at 35-37 weeks, plus intrapartum penicillin prophylaxis to prevent transmission. Treatment: empiric ampicillin plus cefotaxime. Switch to penicillin G for confirmed GBS.